Welcome to the Feeding Our Young podcast. Have you ever heard the phrase, nurses eat their young? Feeding Our Young is more than a podcast. It's a movement. It's a desire to see new nurses of all ages be supported and uplifted by their peers. And it starts with me. It starts with you. So join host Eric Miller, registered nurse of nearly 20 years, an adjunct clinical instructor, and today's honored guest, me, Lisamarie Pietragallo. And be ready to have your life uplifted so you can, in turn, uplift others. Welcome to the Feeding Our Young podcast.
Hello and welcome to this episode of the Feeding Our Young podcast. So today is going to be a fascinating day. For the first time in many months, I have a 3-session recording day. The good news is this honored guest doesn't have to put up with third recording session Eric. She gets fresh in the morning Eric, which isn't saying much because I got 2 3/4 hours of sleep last night and decided to solve that by running a half marathon, number 184, for those who really care and or are keeping count. And so I did that at 3 o'clock this morning, took an hour nap afterwards, have my mug of tea, and we're just going to see what comes out of this. So fortunately, my counterpart is super professional, super fun, and we're going to learn a lot of things about her and her passions. So I am not even going to try and butcher her last name. And in that effort, because she's Italian, I'm going to let her introduce herself instead of me. So if you don't mind, who are you and where are you from?
Well, I'm gonna mess you up even more because my professional name is Lisamarie Pietragallo, but my legal name is Lisamarie Pietragallo Moreschii. So, 2 Italian names there that you can't pronounce.
I was really hoping you were going to give the full name because I saw it on the thing and I'm like, well, she's going to give the short version or the long version. We got the long version, everybody.
So I have one name by day, one name the rest of the time. And I am from Northeast Ohio.
Northeast Ohio. So
originally from Pittsburgh. So I'm a Pittsburgh girl, black and gold through and through. So,
well, this has been a great interview, Lisamarie. There were certain things I did not know about you prior to starting. I hope you have a great nursing career. Have a good day. No, just kidding. Glad you guys had Russell Wilson, and I'm just going to leave that at that.
Take him back. Take him back.
Well, that's okay. You might replace him with Aaron Rodgers. So.
That was a dinner conversation last night with my husband. We are not happy here.
At the time of this recording, the Seahawks, my beloved Seahawks, have just signed Sam Darnold a couple days ago. They're doing this mass exodus of our whole offensive front. Congratulations, everybody. You're in a sports podcast all of a sudden. But no, prior to that Sam Darnold signing, I read multiple articles of rumors that we were going to talk to Aaron Rodgers. I'm like, what did I step into an alternate universe?
Exactly. Oh my gosh. Exactly. It's crazy.
All I'll say is Super Bowl 40. That's the only ill will I have towards your particular passion. And we're going to leave it at that because there was some very bad things done that day in the name of furthering the bus's retirement. And that's okay. It's fine.
I love that man.
Oh, he was incredible.
If we need to continue the sports podcast, I need to bring my husband in here because I just like the Steelers. I don't remember Super Bowl 40.
That's good because all of us in Washington State certainly remember it. All right.
I'm sure my husband does, so I'm sorry.
That's all right. Ben Roethlisberger, blah, 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 whatever. Okay. Before this derails further, let's continue with our traditional opening questions, Lisamarie. No, yeah, there's this little hobby. We're talking football, but we'll get into this little hobby called nursing. With that, I've already established that you're very professional. So, ergo, I think you hold at least a degree, if not multiple. Would you mind enlightening us? What degrees do you hold? When did you get them? And maybe where did you get them from?
Well, I am old school. I graduated in 1990 from St. Francis Medical Center School of Nursing in Pittsburgh. Doesn't even exist anymore.
Oh, wow.
And I am one of those people who, life happens and health issues, get married, you have kids, raise the kids.
Yeah.
So I took a little hiatus. I did a whole lot of things in nursing. I was, when I was an RN, I was a liver transplant ICU nurse at the University of Pittsburgh and did so many fun things back in the day. And we did the first baboon to human liver transplant, and I worked with Thomas Starzl and the whole mecca of liver transplantation. And then I did home health and a whole bunch of things. And this is one of the reasons I love nursing, because there are so many different things to do in nursing.
Yeah.
And you can change paths and hop around and do something that suits you during that time of life.
Yeah.
So I did a lot of home care visits when my kids were young. And honestly, I did home care visits because I wanted to keep my IV skills up.
Nice.
Because when I was in college, because I did go to college before nursing school, I went to University of Pittsburgh, and I was a phlebotomist, and I taught phlebotomy that many years ago. So,
Yeah.
it's just kind of the natural progression. And then when my youngest was in high school, I went back to finish my bachelor's, and I finished that at Chamberlain. And then I went right into grad school at Maryville University
Oh, wow.
and got my family nurse practitioner. And now I
Incredible.
am a mini thesis away from a PhD in holistic nutrition.
What?
Yeah.
A mini thesis?
Yes. I go to a school called Rockwell School of Functional Medicine. And it's pretty cool because with all the, I don't even want to count, do the math, people, 1990, 2025, right? all those years of traditional medicine training and education and all the years of working in traditional medicine. Last year, I started my own functional medicine practice and got certified in functional medicine. So I strictly do functional and integrative medicine now in my practice. And I felt I really needed a nutrition degree because I'm doing a lot of lifestyle and eating, plans and things like that. So I wanted not a traditional nutrition degree. So Rockwell caters to traditional medicine providers who want the functional medicine aspect of things. So in my opinion, I don't want to say the complete opposite, but it brings a really well-rounded aspect to the traditional education, just really focusing on the holistic aspect of it. And because they cater to professionals, their attitude is you have the advanced degrees, you've already done the research, you've written the papers. If you would like to do a full thesis, you're welcome to, but it's, so it's a mini thesis.
That's incredible.
Which is kind of cool because I think I would not have been up for an entire thesis.
Yeah. Yeah. Wow. That's
kind of education for the purpose of it.
Yes, and that's being a WGU, Western Governors University, native myself, getting my master's degree from them. That's what I really appreciated about them is very much like it's competency based. What do you know? Let that forward you, and then the things you don't know, let's teach you, and then you end up with a degree, and it's just fantastic. You're not learning things for the sake of checking a box. You're learning things that are practical and necessary for your degree.
Exactly.
No, that's absolutely incredible, Lisamarie. Thank you for sharing kind of a very brief snippet of your educational journey. For those that are like, if you're longtime listeners of the podcast, I don't know what long time qualifies for here. We're not even a year old yet. So that's long time. If you're listening to every episode, there you go. You've listened the whole time. But we're no stranger to functional medicine here. I've had an honored guest or two talk about that. And so for those that is not your cup of tea, like the cup of tea I'm drinking, please don't tune out because this is not an hour about functional medicine, but we are going to talk about Lisamarie's passion for that later down the road. But you don't want to miss what we got coming up. So we'll start with the traditional stuff as we always do. Lisamarie, you chose 3 words to describe nursing school. What were they?
They were life-changing challenge, I believe.
Life-changing challenge. Love it. And
Yes.
we'll talk more about that at the end. And in the interim, what are 3 of your favorite songs in life right now?
We will go with genres because I am
Genres.
very eclectic.
Love
So I love my 80s rock.
Oh.
You know, gotta love the classics.
Mm-hmm.
Journey,
Mm-hmm.
going even back further, before my time, I will say. Classics, classic rock. But
Yeah.
lately I've really been into Five Finger Death Punch. And
Five Finger Death Punch.
Finger Death Punch, and I think Jekyll and Hyde might be one of my favorites.
Oh
That's kind
my gosh.
You know, blow off some steam.
Yeah.
Not a fan of their hardcore stuff, but
Yeah. Yeah.
Yeah.
You know, so it's funny that you brought that up because Five Finger Death Punch, I'm not huge into heavy rock myself, or heavy rap, or even country doesn't make the list for me. Sorry to all you country lovers out there. But my best friends love country, so it's okay. I still get exposure. Yeah, it's all right. It's acceptable. We won't spend the next 20 minutes dissing that. But no, the Five Finger Death Punch, when I was at kind of one of the lowest points in my life, ironically, there were 2 things that got me through it musically, from a musical standpoint. One of which was the Legally Blonde soundtrack, no joke, and the other one was Five Finger Death Punch. And I would listen to those things often. I had to do a lot of driving for my job at the time after I moved over to get my associate's degree. And Five Finger Death Punch was one of those bands that, for whatever reason, just spoke to me in that time of life. It was very strange. So I'm so glad you brought that up. That's so awesome. Okay. So now the fun question that you were not allowed to prepare for. So sorry, Lisamarie. But this is our unofficial Feeding Our Young personality quiz. And at the end of it, we will determine exactly the type of person you are based on the answers you give. You have been prepared that this is coming your way, correct?
yes.
Wonderful. All right. So you may give as short of answers, or as you can give rationale if you want. It's up to you. But otherwise, rapid fire. Here we go. Are you ready?
I am. Bring it on.
All right. Would you rather instantly learn a new language or an instrument?
Oh, a new language.
Are you team pie or team cake?
Team cake.
Would you rather have the ability to fly or breathe underwater?
Fly.
Okay. Is Wham's song titled Last Christmas actually a Christmas song?
Yeah.
Okay. That was a pretty confident. Yeah, we'll take that. And the last question. You've just been gifted a time machine. Congratulations. Are you going to go back in time, or are you going to see the future?
Oh, God, I'm going back in time.
All right, and there it is. The results are in, and you are amazing. Congratulations. Yay. All right, so now that we've got the non-nursing things out of the way, let's circle back around, and let's talk about your life. Is that okay? Is that good? We'll just go right in there. Let's open with just kind of a little bit of Lisamarie, the person. I imagine that you've got a hobby or 2 of your own there. I've already mentioned my penchant for running, but what kind of hobbies, what gets you going when you're not doing all the millions of things that you seem to have your hands in?
Well, let me just say that I think hobbies are necessary for everyone. They are so good for cognition, for mental health, you name it. So I have been a huge advocate of hobbies for a very long time. And I was, one of those kids that I would go to sewing class when I was little, and craft class, and I knit and crocheted when I was probably old enough to hold a needle. Been doing it for so long, I don't even remember. But, and I think because I failed to mention, I did research when I worked at the University of Pittsburgh. Okay. And I think that made me everything, right? First of all, nurses, we are a unique breed of people. Yeah. And I think, we go down rabbit holes. We don't want to leave any stone unturned. And I think that just pours into every aspect of life. And so now I've been a nurse for, we know, a very long time. I was a nurse before we had universal precautions. So
Ooh, there it is, everybody. That might even be the title of your episode. This is great. I was a nurse before universal precautions.
there you go.
Yeah.
So that being said, I think it really just, I'm a researcher at heart. So,
Yeah.
which is probably why I'm where I am now professionally. But going into the hobby realm of things during COVID, when everybody needed a mental outlet, right?
Yes. Yes.
I spent 3 years. It started off dyeing yarn because I really got into my, knitting and crocheting and crafting then. So I started dyeing my own yarn, and that turned into, I don't know how, but it turned into making candles. And yeah, my research kind of led me down the rabbit hole of creating a clean burning candle line. So I experimented with different waxes and researched how, what they put off into the environment, and should you be breathing it, because we all want to live a healthy life, but I love a good candle. I love a good candle. So I played around with clean burning scents and researched all of that. So, nursing really defines who you are. And I think it's really funny when you look at and I don't even know, it's kind of like which came first, the chicken or the egg, right? Do we go into a certain kind of nursing because that's our personality? Or does the certain type of nursing we go into make us? Like, does it, which probably a little bit of both.
I was going to say, I feel like it's like a positive feedback loop, right? Like one feeds the other, which feeds the first, and round we go.
Exactly. So, med surg nurses, God bless you, different personality. ICU nurses, trauma nurses, we all have our own little, but I think we all, and I say this in a very loving way, and, we all have our own little bit of neuroses, right? At the core, as a nurse, I think we all share that kindred spirit, and I love nurses. You could be a total stranger, and I can hear you're a nurse, and we're striking up a conversation.
and you're not the first person to mention that either. You and I talked about it briefly before we started recording, and it is, you just, you kind of flock to each other, and you just, oh, are you in healthcare? Oh, yes. You're not a nurse, are you? Oh, I definitely am. And oh my gosh. And then you're just off to the races. So
Exactly. Yeah. And the stories we have to people not in the medical field, it's kind of like, oh, you're making that up. Nope.
Not at all.
We're not making that up. I remember, and I don't even know if I can repeat it, but I was in nursing school, and have what patients said to me that I'm just like, it still sticks with me.
Yeah.
It's just funny.
Yeah. Yeah. The things that, there's just all this incredibly useful knowledge alongside this amazing useless knowledge that just sits in there, and you're like, I remember this distinctly, or it takes you back to, that patient interaction, or whatever the case may be.
Exactly. And again, the good, the bad, which is why it was kind of difficult to pick those 3 words. But those 3 words, I think, were broad enough that it kind of encompasses everything. Because, I think we're like the only profession that, we get abused.
Yeah.
You name it, by staff, by colleagues, by patients. Yeah. And we, but we're with people at the worst time of life. We're usually the ones giving them horrific information, or cleaning up the mess after they've gotten the horrific information.
Yes.
And oh my gosh, I'm sorry. I get goosebumps. Because I had some amazing relationships with patients over the years, and I have a stack of letters from patient families, and you can't get that anywhere else. So we give our all for our career, and our career really defines us. There aren't many careers that it is who you are. Yeah. Even the years that I wasn't necessarily working full time in the clinical setting, I was always a nurse. You always, oh, go down the street, Lisa's a nurse. Or, you know what I mean? You always
Yeah.
have that, and no one can take that away from you. So
And
it's kind of cool, going back to the tie that we all have.
yeah. And I think part of what you're landing on there, at least as far as like defining you and that sort of thing, is partially because it requires all of you. As you know what I mean? Nurses who are listening are just amening the crud out of everything you're saying right now. And nursing students are like, oh my gosh, they've either seen it a little bit already, or they're like, oh, this is what I have to look forward to. And yes, 100% is what you get to look forward to. The good, the bad, the ugly, all of it together. But what do you hear time and time again? Go back and listen to other episodes. Listen to what Lisamarie is saying. This is the best career on the planet. It requires all of you. That's why nursing school requires all of you. And it requires the best version of you that day, even if it's not the best version of yourself. And so you give it your all. And like you said, like same thing. You talk about that. I got down in my storage. I got my nice little box. And I've got pictures. I've got, from my times in Peds drawings that some of my patients did. One patient gave me an acrostic. He spelled ERIC and then like descriptive words for, you know what I mean? Like who I was. It just, and those are the things that, you know what I mean? You just, you carry with you to the end of time.
Yep. I have 3 angel Christmas ornaments, the exact same ones from patients. And one of them, and again, talk about, things coming full circle. I know I mentioned to you, I, at 23, was diagnosed with metastatic thyroid cancer. And it was, at 23 and shocking, my very first year as a nurse, pregnant with my first child. So it was, it was a rough time, but fast forward to my late 40s as a new nurse practitioner in practice, I have a 21-year-old come into my office, doing an exam, diagnosed her with the exact same. It wasn't metastatic. It was the exact same thyroid cancer. And and that was something like, again, so everything in life, everything you go through in your life, like makes you a better nurse.
Yeah.
And I know that experience totally changed how I was a nurse, my entire thing, because being in that, I remember like it was yesterday, getting the diagnosis, and you turn into a patient in a second. So everything I knew went out the window.
Yeah.
You know what I mean?
It's about you. It's about you now.
And it was like, okay, well, what does this mean? What am I supposed to do? So having been in that situation, and again, I remember standing in the exam room with this girl, and her mom wasn't there. And I'm thinking, oh my gosh, it's the first time I meet this girl. I feel this nodule. I'm sending her for blood work, and I'm sending her for a biopsy. And I knew exactly what she felt like. And I just wanted to like squeeze her and hold her and be like, it'll be okay. Even if it's bad, it'll be okay. And, again, a defining moment, at my first year as a nurse practitioner, having that experience was really, really mind-blowing.
I've said it before, and I don't, again, I'm not preaching one version of life in any way, shape, or form. That's not the purpose of this podcast. That's not my purpose either. But I've said it before on the podcast, and I'll say it again. There's an old saying, something that goes along the lines of, that God speaks on the daily, like whispers on the daily, but shouts in the coincidences. And there's just that symbiotic, like, you know what I mean? You're coming full circle where you just said it. The first year of being a nurse practitioner calls you back to your first year as being a nurse and getting that same diagnosis. It's just incredible to me.
Exactly. There's a book called God Winks. I don't know if you've ever heard it.
No, I don't think I have.
It's pretty much talking about this. Like, there are people that will be very instrumental in your path of life. Yeah. And you don't know it at the time, and you may only cross paths one time. Why I am a nurse practitioner.
Yeah.
And you're going to learn a lot about me. So
I'm so excited. So excited.
So, the reason I had a large hiatus in my nursing career is because my husband at the time did not want me to go back to school, didn't want me to work. You know, it was one of those relationships. It wasn't a really healthy relationship. So I
Yeah.
highly recommend to anyone out there, if you're in that situation, recognize it and get out of it and don't stay in it, even for the kids' sake.
Mm.
Anyway, so went back to school, and we were in marriage counseling before the divorce. And I went to see the wife, who happened to be a nurse practitioner, of the psychologist who my ex-husband was seeing.
Oh.
And the nurse practitioner looked at me in the first hour and said, your marriage is over. The energy he's stealing from you is blah, 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 you know, whatever they say. And she said, what are you going to do with the rest of your life? Because he takes up a lot of time and energy, and you're going to need to fill that space.
Yeah.
And I said, oh, I'm going to go back to school, but, you know, I want to teach. And she said, okay. She said, well, she said, you're going to spend the same amount of time and money to get your master's in education to teach nursing as you will to be a nurse practitioner. She said, and they pay you for the prescription pad. So you can teach. She said, you can teach as a nurse practitioner, but you can't practice medicine as an educator.
Yeah.
I met with her one time. That was the only time I ever met with her. And she was what gave me the confidence, because in the marriage I was in, I did not have a whole lot of confidence at that time in my life.
Yeah.
And she made me, I thought it would be easier to get a master's in MSN in education. And because of her saying that, I was like, okay, well, let me give her a try, and started applying to NP programs. And she was 100% right, because as a nurse practitioner, I was an adjunct staff at Youngstown State University for a while.
Wow.
So it's kind of crazy. And again, like I said, I don't even remember her name.
Yeah.
And I think, were it not for that whole situation, I would have never even thought I could have gotten accepted into an NP program, nor made it through an NP program. So,
let alone all the things that we'll talk about that you are doing with your NP, right? Like just one meeting, you know what I mean? One moment, one sentence, one discussion.
So
can
that's a God
change your life. Oh, I love it. And it's fascinating, because I mean, I don't know if I've shared this before on the podcast per se, but I'm really, if you boil it down to its pure essence, I'm a nurse because of my wife. And that is because I, grew up wanting to become a doctor, took a little dovetail into children's ministry. I've talked about that before. And then when we were at our lowest point, I was coming out of full-time ministry going, okay, full-time ministry is definitely not for me. That is not my thing. And so she's like, well, and it's like, we have our first son at the time, very young. And, it's like, okay, well, what are we going to do? And she's like, you're going to go back and then, go back and become a doctor. And like, no, like, I've spent enough time on this little venture that now, especially with having you and our son, and, it just was, and she just legitimately was like, well, what about becoming a nurse? That was it. Obviously it wasn't like, oh my gosh, you're right. Like I looked into it and all the things, and I'm like, oh, that's more in line with what I want to do anyway. But it was just that sentence. The thought had never, the math wasn't in the brain. Those two thoughts never crossed, because I worked in medical records since I was 14. And so in healthcare, and knowing what people did and what roles kind of, what they were for, but never envisioning myself in that role. And so again, same thing. She doesn't say that. Who knows? I don't know. Maybe I'm working in a movie theater. I'm not sure.
That's funny. And
yeah.
I'm the opposite, because I literally have a picture of me. We have it on one of those, electric picture frames of me in third grade dressed up as a nurse. I used to give my baby dolls chickenpox, literally with a needle and color. They were legitimately, they looked like pockmarks. And since I was a kid, so it's funny when people say, did you really know? Did you know what you wanted to be? Well, clearly I did.
Yeah. Yeah.
And, toyed with medical school, because of course, that was, especially in the 90s, it's like, oh, you don't want to be a nurse. It was
Just
kind
a
of
nurse.
exactly,
Yeah.
exactly. And again, if I had a nickel for every single time someone said to me, well, when will you be a doctor? Like so many people don't understand that as a nurse practitioner, and I would say to them, well, if I do become a doctor, it's not going to be an MD. I'll be, and try. So I quit trying to explain it.
And it's so true. You know what I mean? It's like there's almost, and unfortunately, I don't think it's as prevalent today as it was then, but there's
Correct.
still that underlying, you know what I mean? Like, why settle for this lower bar when you could, you know what I mean, aim higher? And we can't, you're hearing it from Lisamarie right here. You cannot. We come away from listening to a single episode of this podcast or talk to a single nurse and get the feeling that we've settled.
No.
Because again, we are in the best profession, and we need our providers. I'm like, I don't get, MDs, DOs, many years of medical school. Sorry, ladies and gentlemen, they learn things, and they're not just looking things up on Google for you. They're not just a voice.
Yes.
They're not the Alexa of Google. They're not telling you things that they're reading. They have done research and done things. So we need them. But for some of us, that's not us. But it also doesn't mean like, well, I did that because, I just didn't want to do all that schooling. And you know what I mean? Yeah.
Exactly. And I explain it to people because again, when you hear most patients who see a nurse practitioner are very happy with their nurse, with the care that is delivered. And again, I don't want to even say it's apples to apples. We're a different species. We're trained differently. And I say our delivery is different because as far as like family practice, things like that, I think we look at the whole person as a nurse. And
Yeah.
at least when I was in my first nursing school for my RN, we look at the whole thing, and we always looked at something instead of a medication.
Yeah.
So our delivery as nurse practitioners is different because we are looking at things differently than physicians are trained to look at things.
Yes. And that's why we need each other.
Exactly.
That's why we need each
Exactly.
other. You need different
Exactly.
eyes, different trained principals, so that we can all come together. And we're all trying to speak the same language but different languages, right? If
Yes.
you've ever had a conversation with a provider and that sort of thing, they're looking at it from this particular angle. So if you find yourself nursing student, or you know what I mean, as you become nurses and that sort of thing, when you are finally interacting with providers, not allowed to do so as students, and that's a disservice, but that's a whole different story. You know what I mean? You're gonna be frustrated at times. Why are you not seeing it the way I'm seeing it? Because they're not trained to see it the way you're supposed to see it, nor are you trained to see it the way they see it. And so that is the whole interprofessional, like the collaborative model of medicine that we find ourselves in.
Yes.
That is one of the plus sides to modern
Yes.
healthcare.
And that's exactly what I was going to say. If you're lucky to have, and I do feel that the best way to deliver care to a patient is through a collaborative effort.
Yeah.
Because the physician I worked with when I started off he was a friend and he was my physician, but we had such a great collaborative relationship. And he would even say to me, because again, and probably from my personal beliefs, what I like to do as a patient, and as an old school nurse, I would look at things totally differently. And
Yeah.
he would say to me, "Hey, I don't understand." Because he would joke around and he would ask me, "Are you still taking Eye of Newt?" I'm like, you know what? If there's a reason for me to take Eye of Newt, I will take it. And we would just like tease each other about that. But
Yeah.
anybody who was worried about vitamin deficiency, hormone imbalance, he was sending to me because he
Yeah.
would say, depression, anxiety. I was the go-to in the office, and it was only the two of us, but that's who, and he would be like, I don't know what to do. You do what you do. And he was fantastic because there were so many things that I wasn't comfortable doing or didn't want to do. And it was like, here you go. So everybody kind of has to stay in their lane and know what they do. And I think that's why, roles get a bad rap. Like physicians look at nurse practitioners because, I think maybe people aren't staying in their lane.
Yeah.
And we need to do the biggest strength is knowing what you don't know. And it's not a sin to say, hey, you know what? I don't know that. I'm going to find out, and I'll get back to you, and we'll do the best thing that for you, instead of, the hierarchy of, your decision trees, which those drive me crazy. When those were brought into medicine,
yeah,
it took away the art of medicine.
And you get into the, thank you for your opinion, but we're going to go with what I was originally thinking, or, whatever the case may be. I don't know.
Yeah.
The buck stops with me, ergo, this is the treatment we're doing.
Exactly. And that's the biggest mistake. That is a fatal mistake.
Yeah. In some cases, probably literally.
Oh, yes. I wasn't even thinking, but you're right. Exactly.
100%.
Yes.
Those who have listened, again, longtime listeners for less than a year, those who have listened know that that's another thing we don't really talk about on this podcast, or politics and things of that nature. I am by nature, and it took me, I don't know, 4 decades to figure it out at least, but I'm okay with the fact that I'm not political by nature. And we've had this discussion with my kids because some are a little more politically bent than I am. And I'm like, that's fantastic. Go research that. Look at that. I can't help you with that. We can look at stuff together, and I'm happy to have conversations with you. But it's not, my nature is encouragement, uplifting. It's almost always been my bent. Yeah, we all have our bad days, all the things, blah, 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 blah. I'm not saying I'm always Mr. Sunshine. The point is, I always lean towards the optimistic. And for me, in any realm of politics, it doesn't matter who's in office. It doesn't matter what, parties in power in the United States. Everybody has their pluses and minuses, but all of it, to me, is not optimistic, nor is it fun to talk about. So exactly. That's not a conversation I bring up, but I'm going to come as close to that topic as I can at this, or that I probably ever will at this moment, because what you said just brought up to me, like, this, you're talking about collaborative medicine, different perspectives. That's why you surround yourself with different perspectives. And you don't, nursing student, fellow nurses, this is why you don't want to, yes, it's a lot better to hang out with people who are more like you. By golly, that's great in your hobbies and in your personal life and all the things. But when it comes to medicine, when it comes to caring for others, when it comes to those important matters of life, education, those things that really kind of have proven over historically that have upgirded societies, you don't surround yourself with like-minded people. The old yes men and all the things. We might be seeing that right now in office. And that, again, that's as close as that's neither here nor there. I will tell you right now, everyone's like, oh boy, okay, then now we need to know. Did you vote for our current president? Did you vote for the last president? You know who? I will tell you exactly who I voted for every single presidential cycle for as long as I've been able to vote. And yes, go out and vote every time you can vote. Use your voice, whether or not you believe it's counted. That's a whole different tangent. But I'll tell you who I voted for every single time. I have always said I will vote for the right man or woman for the job, period. I don't care whether they're red, blue, purple, green, polka dot, striped, whatever. And that may upset some of you who are very one side or the other. I don't even know that I could consider myself a moderate. That's yet another label that, you know what I mean? But the whole crux of this, let's see, I just took 3 minutes to explain a 30-second concept. But the whole point of it was, don't surround yourself with like-minded people. When you're going through nursing school, you're going to find those educators that challenge you. And we've talked about this before. You're going to find those nurses that you're following on site that are going to challenge you. And by challenge you, I don't mean like, hey, let's put you, kind of that, what appears to be a good way. You know what I mean? Like, let's push you past that comfort zone of yours, and let's get you trying new things. I'm talking about the ones that you just can't stand. And we've had honored guests that have said, there was this one person who was like my nemesis on the job or when I was in nursing school, and yet I learned the most from them. Don't surround yourself with like-minded people.
Oh my gosh, I second that, because so many things are in my head based on what you just said. But I agree 100%. In my opinion, we're caring for everyone. I don't, it doesn't matter. You can be, I could be a healthcare provider in a prison. I don't care what you did. I'm not there to judge. I'm there to take care of you.
Yeah.
The number of people I've encountered in my years, again, good, bad, ugly, whatever. I didn't mean that literally, but it doesn't matter to me. I'm taking care of you as if you're a family member. That's my job. I'm not there to judge. We have too much judgment going on right now, which is why everyone points fingers. And, you've got it. Anyway, yes, you said it perfectly. And I will also say, to your point, that my most dreaded nursing instructor became my absolute favorite. This man, I mean, and again, right in the dark ages when I went to nursing school, we, made beds in hospital corners because back in the 90s, late 80s,
horse and buggy, chalk and slate. Yeah, that whole thing. Got it. Yep.
Exactly. We were the staff, in these hospital schools. We had one semester in the classroom, and after that, clinical hours started. And your last year, we were 40 hours on the floor.
Oh.
So the nursing staff was so happy when the new students were there because we did everything. We passed meds in our, the last semester, but we did all the grunt work that the nursing staff didn't have time for, didn't want to do. So it was a totally different education at that point. But the nursing instructor that just grilled you and drilled in documentation, and again, this is pen and paper. When I was working in the ICU, in the liver transplant center, we had fellows who would every July would come in with a bit of an attitude because they finished their residency. They were already full-fledged and they knew what they were doing. Well, you do until you're dealing with someone who's having a liver transplant because they're a totally different patient, right? So, we always had a little bit of an attitude. They always had a little bit of an attitude, and they finally understood that the nurses are the ones who knew what they were doing. But they were blown away by this documentation that I would have done with my patients. And it just became, was something that you hated. But then this nursing instructor, who was horrific in the day, made me, the pay attention to all the details. So you go to love them, and they make you better people because those comfort zones and those people who you hear everything you want to hear from, you don't grow from that. You don't grow from that at all. So, and one little thing I have to say about research, when you don't want to look for what you want to find, if that makes sense. You want to, so when I'm researching anything new, a treatment plan, anything like that, I will pull everything I can because I want to hear the opposite of what I think. And I want to know why these studies are showing the opposite. And then I want to take my knowledge, my experience, and what my patient looks like, and put all of these research studies together. And, research kind of has to be taken with a grain of salt because most of them will show a bias based on what the researcher wants to prove. So that's why, you can find research to support anything you want, any viewpoint you want to. That's why you need to look at all of it to make the best treatment plan for anyone. And even for yourself, if you want to, if you're researching your own healthcare, look at all of the perspectives and then come up with your own decision.
And precisely because what you're trying to do is weed out the human element of the research because we're humans.
Yes.
And so therefore, you know what I mean? Whether we are cognizant of it or not, we're bent towards one thing or the other. And therefore it's that confirmation bias, right? Like I think that's the term there. You have an idea and therefore what's the deal? I'm going to go out. I want to buy a new car. I want to buy a Hyundai. I want to buy a red Hyundai. Okay, great. Guess what? You're going to start seeing all over the place. Red cars, Hyundais, and specifically red Hyundais.
Yes.
So you have to weed that out by comparing all those things. I cannot stress enough. Thank you, Lisamarie, for bringing that up. Okay, so I'm looking at the clock, and I know she's got a lot more to say. So right on the spot, Lisamarie, we okay with part 2 of the Lisamarie experience?
Absolutely.
Let's do it. All right, everybody. So take your little breather. Maybe you're going to listen to the second part on your way back to work tomorrow or your way home tonight. I don't know. Or you're just going to binge the whole thing. But join us. We're going to take a super long 1-minute break, and then we'll be right back. Here's what's happening on the next episode of Feeding Our Young.
I have tried to live my life that I would not have any regrets. And looking back on my many years, as we established, the only regret I have is, trying to cram that square peg into the round hole. And I think as nurses, we want to fix people. And at our, the expense of ourselves. Yeah. And I feel like I don't want to say wasted a lot of years because, life brings you everything. It brings you your experience, even in bad times. Mm-hmm. But I'm happy to say I'm lucky enough. I feel like I refer to this now probably as Act 5. As you go through life, my first nursing career, first marriage, have amazing kids. And I recognized during that time that I needed more. And I was giving a lot of myself up. And now, fast forward to everything I've done. I mean, from my mid-40s, I finished my bachelor's, got my master's, worked on a PhD, had 10 amazing years as a nurse practitioner.
Did you like today's episode of Feeding Our Young? Let today's honored guest know by emailing us at thanks@feedingouryoung.org. Also, if you are a nursing student, nurse, or a nursing instructor and would like to be featured on a future episode, please email us a few details about yourself at the very special email address mystory@feedingouryoung.org. If you have a question you would like addressed in a future Q&A episode, please send it to q@feedingouryoung.org. For all other inquiries, please email us at info@feedingouryoung.org or text us at area code 509-ALL-THEM 509-255-8436. We're so excited to have you return to hear our next honored guest. Be sure to follow us on TikTok, Facebook, Instagram, and YouTube at Feeding Our Young LLC. Again, that's username Feeding Our Young LLC. Until next time, be encouraged and go find someone to encourage today.